everyone, welcome back to my channel. My name is Alona Forche. I am a retired public health nurse and a lactation consultant. As I promised in my first video about positioning, I'm gonna continue my journey with you with breastfeeding techniques and strategies that can help you and your baby, in this breastfeeding journey. Now, I'm going to continue. This is a part 2 of the positioning in breastfeeding. Now, I'm gonna touch base with positioning using breastfeeding pillow. Now, the biggest mistakes, I'll tell you, that most moms or breastfeeding moms do is put the breastfeeding pillow right away. Either this is a shape of a peanut pillow. There are so many pillows in the market right now, but you know what I can tell you? If you don't have to waste your money on that big, bulky, peanut, whatever shaped pillow in the market right now that costs so much money, use a regular home pillow that you have at home. Because it's gonna cost you money, and sometimes it's a pain to use it because it's not comfortable and you're just wasting your money. So I'm using a tiny little pillow. Now, what's the trick? The best way to use a breastfeeding pillow, either what shape it is, you need to put the baby first. This is the biggest mistake. Mom would put the pillow first. No. Put the baby first. Why? Because if your baby is small and you have a pillow that right up to here. So if let's say you have a small baby. So you put your bulky peanut shaped whatever pillow you have first. Put it in there. So the baby's up here. Where is my nipple right now? And as I mentioned with latching, the nipple should be at the level of the baby's nose. So where's my nipple right now? My nipple is down here. My baby's nose is up here because of this bulky pillow. So what I'm gonna do, I want to put my baby first. Put the baby first. If you do a cross-cradle position, put the baby first, then tuck in the pillow. So if you need 2 more pillows, especially if the baby is preterm, then use 2 pillows, both sides, left or right. So you don't have to rely on the breastfeeding pillows you found in the markets. Yes, they are beautiful, different colors and shapes and everything, but they're very pricey. So use regular pillow. However, if you can afford it, go for it. Buy a good pillow. So you need this pillow if you have C-section to protect your tummy. However, the pillow, remember moms, the pillow should support your arm, not the baby. Again, pillows are for your arm, not for your baby, okay? That's the biggest mistake. So I need my pillow to support my arm, but not to support my baby, okay? That's the purpose of breastfeeding pillow. Put that away. I want to talk about babies who are hypotonic, meaning have low tone, babies who have Down syndrome. So, baby who's just like not hyper, but hypotone. So what you can do to breastfeed that baby with a very low tone or hypotonic baby. So lean back position, I cannot lean back as far as I can because of my chair, but when you do lean back position, it's called lean back position or biological position, and you can Google it. It is the most relaxing position that the baby can do, okay? Some moms would just put the baby on your tummy like this in your bed when you elevate your head with a pillow. So you lay back like that, put the baby in there, the baby will just crawl slowly towards your breast. You know why? Because the baby can smell the scent of your mouth in your breast. That's why the baby is snooping, trying to find where's that smell. So when you put that position, the baby will find it. And all you have to do is just guide the baby's mouth, guide your breast, especially if you have a large breast, just guide the baby and the baby will latch, okay? You can do this in your bed, you can do this in the couch when you don't have any C-section, because C-section is so hard to lay on the couch, okay? So that is a biological position. I use that for babies also preterm, okay? Because why? Because you know why? It opens the baby's jaw widely when the baby is placed this way. That way, the baby's mouth will be open really wide when you do a laid back position, okay? So that's the trick. Now for babies who have broken elbow or broken neck or broken shoulder because of birth trauma, so it depends on where the defect is. If the broken area is in this side, you do this position. Do not put pressure on that injury area. If the broken neck or clavicle is on this side, so you do this position. So you have to make sure, again, consider the factors that this baby needs to be comfortable with breastfeeding, with latching and positioning. So if the baby has hip injury or something problem with extremities, if you can do straddle position, it's so hard in this one because it's so hard to hold. Straddle position. Imagine riding a horse, but using your thigh. So when you put the baby in a straddle position, you can do this when baby's older. Straddle position is this. See how good it is? So baby is straddled there. I'm positioning my nipple right into the baby's mouth. At the same time, I am supporting my baby's neck and shoulder. Okay? Now, if the baby is really hypotonic, low tone, cannot suck fully because of the jaw deformity, meaning the jaw is not balanced, there's something wrong with the jaw and the baby cannot really fully suck. In this position, you can do some pressuring on the baby's, see how I hold it? To help the baby suck and move the muscle. Okay, this is a straddle position. Now, with that position, I can also recommend a position that's more comfortable for you when you have C-section, sideline position. Sideline position is good for moms who have big breasts. Why? Because the breast will just slide down into the side of the mother when the mother lay on the side. So it's easy for the baby to breastfeed when it's sideline, and it's comfortable for the baby as well. Now, some people would ask, should I need a pillow for the baby? Yes, put a pillow just to support the baby's back or your arm to elevate the baby's body a little bit, just to level the baby's nose into your breast. So you can use pillow for support. You can also put pillow support for your back. Now, tips. When you're breastfeeding, so that you can fully focus on breastfeeding as well as the baby, go to a place that there is no noise. If it's too bright, dim the light or turn off the light, because some babies are so sensitive to light, okay? Noise is number one that will distract baby's attention. If you have pets around, please put the pets away when you're breastfeeding, because the dogs or the kittens are going to be running away, running around while you're breastfeeding. Breastfeeding should be peaceful until the baby's older and used to the noise, I'm not saying that you don't have to make noise. You have to make sure, especially if the breastfeeding is established, find a good place where you can concentrate, you can focus, and you're more comfortable, and the baby will be comfortable as well. Anyway, with any positions that I mentioned, it is always you who needs to ask yourself, are you comfortable in that position? If you're not comfortable with certain position that I taught you, do something else. You need to be inventive. You need to find a way on how you can feel comfortable, because again, there is no such thing as perfect positioning until you know the tricks. You know the skills, okay? So sit back, relax there. I'm gonna have more videos later on how to calm down a crying baby, things like that, how to maintain baby's weight, stuff like that, baby puking, vomiting, whatever, everything in this breastfeeding journey. Follow with me and we're gonna have a good time. Well, thanks again for watching, and this is the positioning part 2, and I hope you learn some tricks that I showed you and enjoy breastfeeding. Thank you.